Respected viewers, you must already be knowing there are the three parts of the nervous system only. That is, brain being the head of the body, spinal cord, which controls all the reflexes of the body from head to toe. And then the third part is spinal nerves, which takes the blood to different parts of the body. That is, it includes head, it includes toe, and the parts in between as well. Now, basic structure is of bones, but bones start getting weaker when there is a subluxation in the spinal cord. Why do the bones get weaker? That is, bones are composed of 7 things: calcium, vitamin D, magnesium, phosphorus, silicon, copper and fluoride, which we take from the diet and then our body consumes it. But as we grow old in age, or otherwise even in young age, there is a deficiency of some chemicals. For example, some of the chemicals like calcium, magnesium are dependent on vitamin D reaction to get absorbed in the body. In case there is deficiency of vitamin D, then the calcium etc. won't be able to get absorbed in the body. Then there will be weakness in the spinal cord. Weakness will be as shown on the chart in 3 phases. Initially, the bone gets straight and the distance between the vertebrae start increasing. And then finally, as you can see on the phase 2 and then the phase 3. Once there is a stress in the spinal nerves, then the subluxation occurs. As you can see on the chart, it compresses the nerves and thereby flow of the signals, sensory signals from brain to the body and vice versa. That is body to brain. Once there is a subluxation in the spinal cord, because between every 2 vertebrae, starting from cervical, going down to lumbar spine. Because after the lumbar spine, there are 5 fixed vertebrae. In between these 24 vertebrae, there are discs which gives you flexibility to bend down, to move left and right. And similarly is the case for the neck as well. Neck has 7 vertebrae starting from the head. The first vertebra starts from the head. And then there is a 7th vertebra, as you can see on the chart with the help of arrow. Once the bones start getting weaker, then the bones, because of the stress of the nerves, there is a subluxation in the body. For example, if there is a subluxation in C1, C2, as you can see on the chart, then the pressure will come on the head, face, eyes, ears, and the upper part of the neck. There will be neck pain as well. Constantly, you will be feeling severe attacks. You may feel even the severe attacks of migraine. In case there is a subluxation in the lower parts of the cervical, that is at C6 and C7, from C6, it will affect body upper part. That is, you will start feeling pain and in the neck, in the shoulders will get heavy immediately. And then in few cases, in case you ignore the problem, then it will go into a frozen shoulder when you will feel the difficulty in moving the arm as well. And in case of frozen shoulder, then it takes a lot of time to cure it. But in case you go to the doctor initially or go to the chiropractor initially, once there is a start of the problem, then it can be immediately removed. Once there is a subluxation in the C6, you can see the immediate result. That is, if you align your central line in the palm, there is a difference in the length of the fingers. And you will not having the full flexibility of the neck. It won't turn to 80 degree. It won't turn completely. You will feel pain. You will feel stress at the back on the sides. There will be neck pain. Pain in the neck is a very bad terminology. That is, it pinches every time you make the movement. But in case of this problem, in case you go to the doctor, he will diagnose it. It can be diagnosed with MRI as well, in case of you go to allopathic doctor. But in case you go to the chiropractor, he can, without MRI, visualize it, check it, diagnose it, and then you can get the treatment done. The results will be immediate relief you will get. Immediate relief in a way, the moment the cervical spine is adjusted, immediately the result will come and you will get the relief. You will get the relief where, if it is in C1, C2, migraine will vanish. You won't be having any more migraine. You can have facial expression in case of subluxation. You will get the relief on the face, eyes, ears. Many patients come to me when there is a lot of noise in the ears. And after all the tests, they finally come to me, and once I correct the subluxation in the C1, C2, the results are immediate. Relief is immediate. It is immediately rectified. And in case of C6, your arms length, your development of the arms, heaviness in the shoulders, all goes away. And there could be even in pain in upper back as well, because of subluxation C6, 7. Upper back, that means in between the two shoulder blades. In case of disc bulge or disc protrusion or subluxation in C6 and 7, your thyroid glands will also be affected. In case your thyroid glands get affected, then these will reduce, thyroid glands will reduce their function, and thyroxine will not be produced as much as the body requires it, and your complete hormones will be affected. Viewers, you are welcome to go to any chiropractor. The result will be immediate. It will be without medicine, it will be without surgery. You will get the immediate relief, and you will see that the pain start vanishing the moment you get the chiropractic adjustment done. Now stay with me. I will show you practically how we chiropractors carry out the adjustments. Okay? Be with me.